On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Missouri beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just a place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more of North.
What I love most about Norfolk County, I think, would be the vastness of the county, how it's big and there's breathing space, and there are so many little pockets of beauty, natural beauty.
I love the seasons here. The springtime, the rain falling on the earth. I'm a farmer, so I enjoy those aspects of it, the smell of the rain. The summer times, we have beautiful warm summers here.
You have such pristine water here. You have some of the finest cold water streams in Ontario with Big Creek and Youngs Creek and others that produce great fishing.
Norfolk is very heavily forested, beautiful color in the autumn. The sun shines very brightly here in the wintertime, so I love the 4 distinct seasons we have here in Norfolk County.
What people find remarkable about Norfolk County, I think, is that our sense of community and us working together.
I think of us as a little bit of, we have these ecospheres in our store. They're these self-sustaining little balls that, you know, completely take care of themselves. We're a little bit like that, you know, in our area. We have so much here.
My kids grow up knowing what it's like to produce a piece of fruit or produce some food, some vegetables, and put them on the table, how much effort that takes. And I think that's important.
When people come into the shop, we pull out the map and we show them the wineries and the breweries, and we tell them about the local dining in town, and we'll tell them about the lavender farm, and along the way show them produce stands that they could stop to pick up some goodies.
Everything that we want to do socially and all of our extracurricular activities are right here. And when you join groups, these people they'll want to get to know you immediately. That's our nature. We're curious and we're supportive and we're interested.
Sometimes opportunity just kind of happens when you're talking to someone and having a conversation with someone here in Norfolk. The next thing you know, you're collaborating with them on a project or activity.
The amount of people within our community that support our business is outstanding, because it's a give and take relationship. If you support everyone else, they will support you, and it makes our community that much stronger and that much better.
You know, I think that working with the local businesses here, everyone's very welcoming. Every time I meet a new business owner, and I love to go to new stores and new restaurants that open up and introduce ourselves and welcome them to the community. It's easy to fall in love with Norfolk County.
My advice to a family that's thinking about moving here is to come and visit. Come and spend a week. Come and experience everything that we have to offer, because you're going to find an amazing quality of life.
You're 10 minutes away from a beach. You're 5 minutes away from a dog park. You know, there's so much opportunity in an area like this for young entrepreneurs, young families, even, you know, senior entrepreneurs that are doing that as well.
I'm very happy. I'm lucky, you know, very lucky I can be here, you know. It's a good place to raise family too.
We don't have this sort of slick veneer over us. We're really comfortable in our own skin, and artists are making art because they love to make art, and musicians are writing songs because they love to write songs.
And just because you're not from here doesn't mean that you can't embrace what makes Norfolk great. You know, sort of our diversity, the wonderful landscapes here.
And it's just a great area. You're going to meet great people. You're going to have a supportive environment. We can compete on an international stage with anybody. And that's how we have to start looking at the world.
You just have to be willing to work hard, realize the potential that there is here, and just, you know, put yourself to work and create that opportunity for yourself.
I found that as a young entrepreneur, I was given every opportunity I could want. Just put yourself out there. Go to local events, and you're going to bump into all kinds of people that are going to be, you know, important business connections to you.
Everybody's so willing to help somebody else out. I think that's the best thing about even being a business owner in Norfolk County.
We're a small community, but there's so much support here, whether it's a restaurant or ecotourism. We just have this appetite, and if you've got a great idea, you've got a willing community that's going to get behind your idea.
You know, some of the advice that I would give entrepreneurs coming to Norfolk County would be to think outside of the Norfolk box, but don't forget what's in the Norfolk box, because we have a lot to offer. We have a lot of great people, a lot of great opportunities.
Norfolk County.
Entrepreneurs grow here.
Norfolk County.
Ideas grow here.
Norfolk County.
You grow here.
You grow here.
You grow here.
On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along. On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Take in the small town atmosphere, be amazed at all that we grow. like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more of Norfolk. On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long.
Great. Let's get started here if everybody's ready to go. I'd like to welcome those that are viewing the meeting on our web stream on Eastlink today. And for those that are in attendance here this afternoon, if you could please ensure that your phones are on silent mode. Ryan Wallace is here volunteering to run the camera today, so thanks Ryan for doing that for us. Before we begin today with our Board of Health meeting, again, we did this last week. I just want to touch on a minor procedural matter. I'm proposing that we only perform recorded votes on staff reports and bylaws unless otherwise requested. So unless there's any objections, we will proceed. I am happy to welcome back to Council Chambers here, Councillor Columbus. I see you even got a nice haircut for us. Wonder where you got that from. And I'd also like to welcome Mayor Hewitt as well, who will be a non-voting member. With that, I'll call the Board of Health meeting to order. We have some added items of communication for today, 5A. 2 through 17, they are before you in the ivory package. Are there any further changes to the agenda? Councillor Van Passen.
Thank you, Madam Mayor. I'd like to add a closed session at the end of the meeting for what is it, client solicitor advice, please?
In regards to?
potential litigation. That's what I was going to say, yeah.
The only thing I would recommend to the board is that you would consider that it must be of the really utmost urgency to add something, closed session discussion at this stage.
I'll be honest, kind of as the chair, I'm curious what the item is of the potential litigation.
It was something that was posed to me last night that I sent an email to the solicitor, and she suggested that we deal with it in a closed session.
It would be helpful as the chair of the Board of Health if I received such information, if you wanted to add a closed session item out of nowhere and then not even tell us what it's about.
It's a potential class action lawsuit.
Okay, Councillor Van Passen, I think I'd prefer just to leave it off, actually. If we get to the point where there is something that comes about through a question that's posed by a council member that may be subject to solicitor-client privilege, at that point then it will be revealed in open session what we're going in for, and at that point we could pose, if there's advice Paula wants to give confidentially, then we'll do that at that time.
Thank you.
If it's necessary. Okay, seeing none then, I have a motion to approve the agenda that's been moved by Councillor Van Passen, seconded by Councillor Columbus. All those in favor? And that's carried. Next item, any disclosures of pecuniary interest? Okay, seeing none then we'll proceed. Approval of the minutes, we've got the minutes of April 28th meeting before us. Unless there's any errors or omissions, they will be declared as adopted. Deputations. First deputation today is going to be John Henderson. Staff have recommended that both deputations participate electronically, and so they will be joining us here on the live stream. Before we hear from the deputations, I would remind the board members that Section 22 orders are really not before us. Specific to the second deputation today, there's an upcoming tribunal hearing upon the matter. So I guess my advice to board members then that expect comments made today could also become part of that hearing. Staff are recommending that the board refrain from discussion or debate on that matter. It's a recommendation. Mr. Henderson, if you'd like to go ahead.
Thank you, Mayor Chop, councillors present, Mayor Hewitt as well. Just as a point of clarification, 2 points. I am speaking on behalf of myself and several property owners across Norfolk and Haldimand County, from as far away as the mouth of the Grand River, but not specifically addressing you as a board of director of the Ratepayers Association for Long Point. Secondly, to clarify what the mayor has stated, both Order 22 or Section 22 orders and their appeals are going forward, because the appeal or the Section 22 order was rescinded with pressure last Thursday and released after work on Friday, does not entail and the appeals both through Wednesday and most of the day on Friday, with the appellate board in Toronto dropped or waived. So to start
with, I'm going to make a correction. I don't think that it's fair to say that the order was repealed because of pressure. I think that would be to Shanker to speak to that and not to insinuate publicly on why an order was or was rescinded. I don't think that's appropriate, but we'll allow the deputation to begin.
Okay, out of the kindness of someone's heart would be acceptable to myself. On that note, yes. The Section 22 order.
John, can you just hang on 1 second?
And the other one, a mic, the mic that you're talking to, but I'm not there. I'm on the picture, but on the corner that I have, it's only on the back that I can touch this, and it says pause. That's two little in the corner. I guess it would be the right corner. That's basically.
Roger, can you hear me?
Can I hear you now?
Yeah. Can you push mute on your? We're going to start the meeting and listen to the deputation. Can you push mute?
Okay.
You see, it's like a microphone with a line through it.
Well, it doesn't seem to work for me anyway, so, okay. I don't know what's going on, but it's not working. My picture's here, but nothing else.
But you can hear us.
I can hear you.
Okay, the problem is we can all hear your phone conversation right now.
Can you hear me? Can you hear me?
Yes, we can hear you and your phone call. So if you look on your screen, there's a thing that looks like a microphone.
Yes. Very top, it's a red one. It's there. But I don't have my name on it. That's the only other thing that isn't there.
Okay, maybe, okay, we're just going to start the meeting now, okay? So, you ready?
Yeah.
Okay. Yeah. All right, sorry, John.
I don't know.
Okay, back to deputation number 1. Section 22 order, which I guess the two of the 3 questions that I have. The whole Norfolk Health Unit Board, as we are here in front of. The order was, this order that I am addressing was signed on April 23rd by the doctor. And yet, the last health board meeting took place after that day, 5 days, I believe. It was briefly shown at the bottom of a PowerPoint presentation around page 24 of 26, and was not discussed, not disclosed, not explained, even when questions were asked as to its meaning. 7+ days later, that order was decided to be mailed out to the affected residents, to their, I believe, their tax roll addresses, which was appropriate. But there was no way of getting this order that had been signed, and it is a public order. And it's curious as to when the health board and its directions to the safety of the public, if that is truly what that order was about, why it would take 7+ days, then the mailing from Norfolk County staffers, another 7 days by law in the Canadian Ontario legal code, that 14 days would pass. If this order was so important, why would a doctor or legal counsel allow that many days to pass before serving the individuals that are at risk? And that question has been posed to myself by many residents and taxpayers across all of Haldimand and Norfolk County. We have not had an answer about that yet. Is is a Section 22 order suitable in this case? After the order was out, there was a letter provincially by Dr. David Williams, the Chief Medical Officer of Health, who explicitly recommended, strongly, I believe is his term, not to use Section 22 orders in this case. They should be reserved for something more specific to a localized, specific outbreak, and this is not localized, this is worldwide. Still, after that, no change from the health unit. Wondering why, and looking at, with those in place, how did we get here? Why would we go to this route, cost taxpayers money from a county, well, aside from Mayor Hewitt's county, who's in great shape, our county, who's broke by the admission of council and the mayor, why would we spend thousands and thousands of dollars to mail letters, to tie up time, to something that was rescinded or dropped prior to its application being put in place by any of our bylaw officials or health unit officials, and then now tying up provincial time in appeals going forward. It doesn't seem to be a wise use of time politically, financially, or with goodwill from the taxpayer of any of either one of our counties. There was also many letters and phone calls sent in to the doctor. Many times they were returned, phone calls and correspondence, from a very busy time. I will give the health unit that credit. The one aspect that came out about this was that if you could justify your request, we have a, quote, list of people that we will not bother, visit, or charge if you justify that. Write us a letter, email, and we will get back to you. I was told directly by several people that they disclosed very personal health, mental health, physical health, and family reasons for their need to make use of their secondary or cottage residence in Haldeman and Norfolk. These details, names, addresses, mental health records, and family disclosures are sitting somewhere with the doctor's staff, the health unit's email servers, Norfolk County's email servers, and they were shared with Norfolk County Solicitor, as well as, I'm assuming, the mayor's office. These records are of a very, very significant and intimidating factor if they, number one, float, stay out there. We have had breaches before, around the time of dismissals of some of the senior staff in Norfolk County. So to say that this could not happen would be a stretch. There's a serious concern out there of the privacy of how this information will be treated going forward. But the underlying fact that's of most concern is that it was asked for in the first place. Why would anyone, including a doctor, request details of family, mental, or physical health or threats to be put on paper and kept on record to avoid charges by a bylaw or health official officer? There was about this happening in the First and Second War. And I know that's a very, very big stretch, but we still have families in this community, both in Haldeman and Norfolk, that have heard about that, lived with it themselves, and that is an absolute insult to all of us. The dollars spent on that and will be spent on this is absolutely crazy. This list is of very serious nature, but our goal is going forward with the appeals that this type of order and decision will never ever be used or abused going forward. Our secondary residents, our properties, the taxpayers that pay for everything in this community, just like our farmers or residents in town, we have and they have the exact same rights. Don't start classing first class, second class.
You have 1
third
minute
class.
left, John.
Thank you. Again, the documentation from the health unit, the provincial chief officer of health, is all on record. I would say that by doing this, with the house cleaning that's taken place in Norfolk over the last 8 months, this was one way to save a lot of marketing and advertising, because every newspaper, TV, media station across all of Ontario knows exactly where Norfolk County is today. Job well done. Finish.
Thanks for your deputation. Are there any questions or clarifications from the board? Shankar, did you wish to speak to anything? Or we can... Absolutely. I have a motion to receive the deputation as information. Moved by Councillor Rabbit, seconded by Councillor Columbus. Anything further on that? Okay. All those in favor? Opposed? Can't see. Councillor Huffman, I didn't see your hand there. Okay, that's carried. The next deputation is Hayden Dooney in regards to the Section 22 order with the three-person to the bunkhouse accommodation and Norfolk's approach to agriculture.
Can you hear me okay there?
Yep, Hayden, we got you.
Mayor Schaaf, councillors, thank you very much for letting me speak today. One thing I am going to ask ahead of time, if there will be any questions taken, would it be possible for me to exceed the 5-minute limit on the presentation here today?
We'll give you 10 actually, if that works for you.
Thank you very much. Okay, you have the presentation up in front. We'll get a page 2 if you don't mind, please. Just wanted to start off briefly with who I am, just to make sure that for those of you that don't know me, that you understand what my involvement is in agriculture. I grew up in New Zealand on a family-owned and operated orchard and farming operation. I studied and worked in horticulture. I moved to Norfolk County in 2005, and I'm working in a management position and a grower supplier position for the Norfolk Fruit Growers Association. I'm a first-generation farmer here in Norfolk County as of last year, and as of this year I've made significant expansions to our operation. I'm vice chair of your Ag Advisory Board, and I'm a supporter of all things Norfolk. Next page, please. Section 22 order, and just to hit the key points that I was looking to discuss today. The impacts of agriculture and the food supply, a one Norfolk approach, and giving the ability for mayor and councillors to be able to ask questions, and I really do hope that if you have questions that we will be able to answer them following this, and then also to make a request to the medical officer of health to lift the Section 22 order. Next page, please. So just to talk about the impacts to agriculture and the food supply, Norfolk and Alderman County are the only one that have put the 3-person limit in place for the on-farm accommodations. Travel, just so everybody's understanding of things, workers travel on the same plan, on the same flight. There's more than 3 people on the flight, they're fully booked. Workers travel on charter buses in order to get to Norfolk County. There's more than 3 people on those buses. There have been no reported cases of COVID-19 from farming operations to date. So to talk briefly on some of the past challenges, delays in worker arrival, this goes beyond just the delays of the onset of doing an isolation plan and providing that to the county. So on the original date that the Section 22 order was dropped, speaking to my own operation, my first thing was I needed to go out and find a secondary accommodation for on farm. I did that within 3 days. It was a further 12 to, I think it was 12 days in order for me to get approval of my isolation plan once I had that vehicle on site. And then beyond that, I also had delays because the application process to get start getting workers in will not start until Alderman and Norfolk Health Unit have reported to farms that it's acceptable for them to move forward with the application to bring people in. So there's delays at that end as well. The limitation of maintenance of crop and crop farmings, I think you're all aware that from the news we haven't been having crops progress as fast as what we need to. Changes and reductions in farmings and losses of early season food sources. We're already talking about asparagus today. Next page, please. Some of the current challenges on the Section 22 order. Farmers are working with smaller complements of staff. There's putting a lot of pressure on the farming community at the moment. Everybody in general working in the COVID-19 environment, I understand, is under pressure, but significant pressure is put on the farmers because of the lack of what they have from this. Additional paperwork and protocols on top of the federal and provincial programs and audits also cause an additional strain. So my isolation plan for my farm now results in an 8-page document to be filled in for that plan or that process discussion with the health unit. It does not allow for farmers to make the best decisions for worker safety at the farm. It's health unit protocol driven. Okay, so an example of this is I was talking to a farmer the other day. Instead of segregating their people at the moment, they've moved them into more confined accommodation. And the reason for that is they have to get their isolation plan approved, and they have to be in a situation in order to accommodate those workers. Further delays down the line ultimately result in these people being together in a higher population than what they need to be in the time frame until new workers arrive, because the farmer is not being allowed to manage that situation himself. This situation is not supported by industry or industry representatives. Next page, please. Section 22, administration delays. So as of May the 16th, Alderman and Norfolk County Farms data, we have 647 less workers than the same date in 2019. 300 workers have been cancelled, and 200 workers have been postponed or waiting approvals. The feedback to farms has been that the majority of these positions here in Norfolk County on the cancellations or being postponed are as a result of housing regulations in Norfolk and Haldeman. So Haldeman and Norfolk has 36% of its 2019 workforce, while the other areas have 60% or above currently. Next page, please. Future challenges. Decrease in food production. I think that that's fairly apparent to us now, and we've missed the boat on some of our opportunities to be able to have some crops planted and move forwards. We do not want to miss out on any more opportunities to be able to farm food and have it available to people. Farm debt constraints. Obviously, this is a cost, as it is to all businesses. The cost is impacted more by the Section 22 order here in Norfolk County. These implications go beyond one season. So right now, speaking specifically from apples, our trees have not been pruned. There's an impact on quality this year that we expect to have, and then also for the following season, we will be impacted as well from those decisions or the lack of ability to be able to make decisions on pruning and maintenance in the orchard this season. So just to do some rough numbers, above and beyond what the federal government is helping out with, and what other compliance and regulations are costing the farms, this cost of Section 22 order is in the region of 10 million plus, with the total numbers of employees assessed last season coming into this farming region. Next, please. I want to talk to you a little bit about my Jamaican family. Okay, these are professional agricultural workers. We've had some conversation on humanitarian rights recently, and I just want to give some reassurances here and give some understanding a little bit too as to why farmers get sensitive, when we talk about humanitarian rights and the fact that we insinuate that farmers are not looking after these people. I know every one of these people's names. I communicate with them on a daily basis in English, and I look after them, and I treat them like family. Next page. A One Norfolk approach. So we have a problem at the moment. We have misinformation coming out, and I've shared it with the mayor and councillors here in the last week, some of my concerns. I had a very good discussion with, after expressing those concerns with our CEO, Mr. Burgess. Mr. Burgess has given me some reassurances, and I'm really looking forward to the further opportunities in order to be involved with proactive approach to agriculture as opposed to reacting as we are today. My commitment and many others, if there is a significant want and need in order to make a commitment to help with these decisions that are being made for agriculture and make sure that people are fully informed. I think today if we were to eliminate the Section 22 order and the staff that we have in place going out to regulate, if they were to in turn turn around and give farmers a call and say, how can we help you today? The Section 22 order is being lifted. I think we would have a much better relationship, and it would give an opportunity for agriculture to work better with the health department, and we could come steps ahead of where we are in this current situation. Next page, please. This is my second to last slide. So I just wanted to quickly pop some points up here, and I'm going to read a bit of an in summary while this slide's in place, just to give you some time to review it at the same time. So in Oldham and Norfolk is the only spot with people for bunkhouse requirement. Workers travel on flights at full capacity from their country. There are more than 3 people on a plane. Workers travel on charter buses and are dropped off at various farm locations. There are more than 3 people on the bus. There have been no reported cases of COVID-19 for farm workers in Norfolk County. Hotels are a challenging option for farmers. In most cases, the workers are coming as return employees and are coming to the farm. They've been coming to the farm for multiple years. It is not always possible to communicate with the employee prior to arrival to create some expectations. They are expecting to arrive at their farm and to go to their accommodation where they've left their belongings and are comfortable. Many of these workers live here for up to 8 months a year. This farm is their second house, maybe even their primary house. Speaking to you on what I know, Caribbean culture, expecting a person to eat Canadian food and stand by themselves for 2 weeks in a hotel is absolutely devastating and should be the last option to consider. Why subject a person to this mental stress when there is much better options that exist on the farm? It's unclear as to how to go beyond federal. It is unclear how going beyond the federal and provincial guidelines for quarantining have any benefit to the community or work health. It is clear that the overwhelming negative position is on what the overwhelming and negative position is having on farm workers, Norfolk County agriculture, and food security. No one is immune to COVID-19. Agriculture, food processing facilities, manufacturing facilities, or the health unit for that matter. We all carry some risk with the perspective of groups of people coming together to fulfill jobs and obligations. This is not farmers wanting to avoid taking necessary precautions as to looking after their own farming employees. This is farmers considering all perspectives and asking to be given the option to play an important role in the production of food and the safety of the workers. Next slide, please. My ask today is that Dr. Shanker, Section 22, that relates to the 3 people per on-farm accommodation, be lifted without delay. A lot has changed since March 24th, and we still have the same Section 22 order in place. I'd like to invite any questions, and thank you for having me.
Okay, thanks, Hayden. Any questions or clarification from the deputation? Councillor Columbus.
Yes, thank you, Madam Chair. Hayden, you've been very kind to us today in comparison to some of the letters that councillors have received over the last few days. Just wonder, during this summer months and fall months, Norfolk and District supplies 60% of the fresh produce that ends up in our grocery chain stores and wholesalers. Do you have any idea of what that impact would be, the economic impact on the communities of Hulliman and Norfolk? Any idea? We hear on the newscast regularly that the asparagus is not being picked, trees aren't being pruned. Do you have any gauge of the impact that you're going to suspect in the next few months?
Yeah, well, in line with the amount of workers that we had of our total last year, which is 36%, I think that gives us a little bit of an indication of what farmers are going to be capable of with their current workforce. I hear a lot of farmers talking about a starting point of 30% reductions and potentially more from there, depending on the farming operations. So I think we can expect somewhere in the range of a reduction in food supply coming out of Norfolk County with the current regulations in place to be somewhere in the 30% plus range.
Thank you for that. And I've got a second question, Madam Chair. My other one, the 20 or so letters that we've received lately, a number of those letters talk about the stress that the farmers are having and the migrant workers are having as well with respect to the 3-day quarantine in the bunkhouse. And I just wonder if you can share with us if you've heard of the mental anguish that's taking place with the farm families in our district.
Councillor Columbus, I haven't heard a lot of stories of the mental anguish of the employees themselves. Definitely farmers are under pressure. They're trying to keep things light at the farm. They're trying to engage their employees to not be in a position to be anguished by this. And this is one of the reasons that farmers want the accommodations to incur on the farm so that they can support their workers through that. Specifically, if we look at the ask here today, what I want to make sure that I'm clear of is that we're not asking to bypass the 14-day isolation period. This is still going to occur. We still want it to occur. We want it to occur on the farm in a manner that we can have more control and effect on the process and support some of the things that we're talking about here, some of these mental anguish issues, which can be detrimental to a returning workforce year over year.
Thank you for that.
Shelley.
Sorry, if I'm supposed to be hearing something right now, I can't hear anything.
Thank you, Mr. Dooney. Can you hear me now?
Yes, I can.
Okay. And just to reiterate, I know your ask is that the Section 22 order be lifted. Is there a modification of that order that might satisfy the needs of farmers? As an example, if the number of workers per bunkhouse were raised to maybe 5 or 6, would that make a significant difference, do you feel?
Yeah, I think it's definitely something that farmers would feel that a consideration would be made. But I think one thing, and kind of in line with that, is we have the federal and provincial guidelines. We have bunkhouses of varying sizes, and one thing that we've been clear on trying to communicate from the start is this needs to be scaled to the size of the on-farm accommodations. When we have accommodations on the farm with 6 cooking stoves and ovens, 10 washrooms, and 10 showers, and 5 different bedroom areas, 5 different separate bedroom areas. When we're taking those on-farm housing facilities and we're restricting them to 3 people, it definitely just doesn't seem relevant. So I think a better approach would be to lift the Section 22 order completely and have the health unit go and offer support on defining what our best practices at the farm and answer farmers' questions. as opposed to tell them what they're going to do at the farm.
Thank you.
Any further questions or clarifications to the deputation? Oh, Councillor Hoffman. Oh, we can't hear you. You're on mute still. There we go.
Hi, Hayden. Just a question then for you. If the Section 22 order was lifted, what percentage, you mentioned earlier that right now Norfolk County farmers are at approximately 36% of their workforce from 2019. If the Section 22 order was lifted today, what percentage do you think we would be able to get the workforce up to?
Yeah, that's a really hard one to answer, but I think if you look at comparing between ourselves and through neighboring counties that have received 60% plus of their workforce of 2019 through to today's date, I think we should be able to significantly increase. That's at least a 20% differential there that we should be able to gain on pretty quickly. I know definitely the support of having that Section 22 order lifted would definitely engage farmers into being as aggressive as they possibly could, while still considering worker safety at the farm in order to get traction on getting the workforce here and getting the work done.
Okay, thank you. And one more question. Do you feel that, obviously this is extremely time sensitive because every day is important when we're looking at the agricultural sector and we're looking at planting and farmers need to know, how much crop to put in and looking at what their workforce is going to be. Do you have a timeline in mind that, I guess for lack of a better word, that there's no turning back, that when we hit a point that our food security issues will become paramount and it will be, no recovery per se for the farmers?
Yeah, as far as I'm concerned, we're already at the point where it's paramount. We've already hit that point right now, and we need to make changes effective immediately. Right now, we're looking at harvesting of crops. Some of the damage is already done on the preparation for planting. So I would tell you that the time and the need for this was on March 24th when it was implemented, and if we had have gotten in, then we still would have had an opportunity to be able to take the best opportunity and the best foot forwards. We have aggressive farming operators in this area who know how to deal with challenges, but challenges on top of challenges on top of challenges have created an impediment towards them getting things moving forwards and functioning how they need to as a farming and agricultural business to create a food.
Okay, thank you very much, Hayden.
Thanks, Hayden. Any further questions for councillors? Councillor Taylor, go ahead.
So, how you doing, Hayden? And I've heard that a lot of farmers are taking advantage of allowing people from urban centers to actually come into the farm. Is that 30% of the workforce, including the number of Canadians that are coming in from urban centers as well, or is that strictly the number of offshore workers compared to last year's number of offshore workers?
That's just last year's offshore versus this year's offshore. One thing I will quote on though is that, is that the actual impact and take-up, although it is very promising, it is a very small percentage of the workforce that is needed. The other thing that is I guess, concern for farmers is the additional biosecurity at the farm or I guess worker health and safety at the farm. When we're talking about these workers that are coming in from multiple areas daily and congregating, working in congregation at the farming location, they are definitely a lot more comfortable with dealing with their own farm workers located at their farm from their own farm community when it comes to these times of COVID-19.
Thank you.
Councillor Van Passen, I believe, saw your hand.
Thank you, Madam Mayor. I'm sure we can discuss this question later, but I got to ask Hayden whether he had the same problem I did. When you go to the health unit's website and look up the Section 22 orders, there's nothing in the actual order that says anything about 3 people. That only, you got to be able to find somewhere the checklist with the protocol after the fact, and that's the first place you find out that you're only allowed 3 workers. Now, did you have that same problem trying to sort it out?
Did you hear that, Hayden, or?
Yeah, sorry, there's a little bit of reverberation. Maybe if I could ask you to answer this, put their microphones off mute.
Oh, Councillor Huffman, maybe. I think it's yours there, if you could. Thank you.
Thank you.
Did you need me to repeat the question for you, or?
Good, please.
Or Councillor Van Passen, go ahead.
When I looked up the Section 22 orders on the website, there's no actual mention in the actual order of a limit of 3 people per bunkhouse. That comes later when you look up a protocol and a checklist on how to get your approvals. Now, are a lot of farmers having that same problem, that they don't know where it's coming from?
Yeah, and I think we've run into this earlier on last week. The challenge is verbatim. There's a lot of information that's being shared at the moment. It's not always shared concisely. If we're sitting here saying that the regulation is only in the isolation plan itself, and that we can have more than 3 farmers, then how can we get that changed straight away too? My understanding is that it's specifically in the Section 22 order though.
Any further questions? I'm just curious, Hayden, if you, I'm assuming you're aware of the program that we tried to put together for basically a hotel program for the workers. Are you aware of that? The work that had been done? And I'm just curious, are you aware of the reasons that it was canceled?
I'm aware that it was canceled.
Are you aware of the reasons that it was canceled?
I'm aware of several reasons that it was canceled. If you would like to communicate those reasons, then I would be happy to hear them.
No, I just was curious. I just wanted to know if you were aware of I mean, I was on the phone call in the beginning when there was consultation with the farmers. I was a silent observer, and I wanted to understand the farmers' concerns. After that phone call, that was when I made some further calls on my own to see what we could try to do to alleviate some of the stresses. And ultimately, I think it was a sad thing that it was canceled. So I just was curious what has been communicated in the farming world as to why that program ended. But
yeah, and I think if you want to refer to some of my comments here from today and the farmers' opinions, specifically from a humanitarian standpoint and from wanting to foster the relationships that we've managed in the past, I think if you're looking at it and saying, hey, this was something that was taken negatively by the farming operations that decided not to use it, I wouldn't take it from that perspective. I would look at it from the perspective of these people have been coming up here for a long period of time to the same farming operation. They have set expectations. What we don't want to do is turn off or I guess inhibit our relationships from any perspective. And to give them the opportunity to be able to come to the farm was a lot better option because we have those facilities available.
okay, so I guess then just my other question. I mean, you're asking council to lift the Section 22 order. I mean, you've spent quite a bit of time writing to council with letters and so on. I'm just curious what mechanism under the Act you would like us to use to be able to lift the Section 22 order.
Yeah, I think if you look at my presentation there, the ask is to Dr. Shankar to lift the Section 22 order.
And could you just clarify on which basis that you're asking him to lift the Section 22 order?
Correct. I'm here today to explain to council and yourself, Madam Mayor, as the Board of Health. I'm here to ask for your input and feedback on this and explain to you the reasons why agriculture is being so aggressive against the Section 22 order. I think there's some really relative reasons to consider that it's not adding a lot of value here from the health and safety of our workforce and our community and our families as a farming operation at the moment. And I guess what my intention was on coming to speak today, and from the emails, is to clear up the misinformation that's being transferred around, and to give you the opportunity to be able to ask questions and explain from the farming side why people are so concerned about this.
Okay, I just want to clarify one more time. So in your slide at the very beginning, I think it referenced something like that the Board of Health ultimately had the responsibility for Shanker's orders.
Yes, so my understanding is that the Board of Health carries the ultimate responsibility for anything that the local medical office.
So I'm asking you again, what would you like us to do? How do you believe under the Health Protection and Promotion Act that the Board of Health can effectuate change to the Section 22?
At the farm and at the operations that I'm a manager at the Norfolk Fruit Growers Association, I think the first part of that is having a sit down and a conversation in order to understand the reasoning behind it, and then what mode of action you take at that point in time is completely up to yourselves as representatives of the Board of Health.
No, I'm hoping to clarify, you just spoke about misinformation in the public. I just, again, want to clarify what it is you believe that this Board of Health can do to overturn Shanker's Section 22 order. What are the options under the Health Protection and Promotion Act?
Again, you have the resources available in order to determine by yourselves as the Board of Health. I think it starts with a conversation of reasoning between Dr. Shanker, the health unit, and yourselves as the Board of Health. And I think following that, I think you yourselves have to be able to make the decisions on how you want to move forward. If you want to accept that, or if you want to have discussions about removing Dr. Shanker as the local medical officer of health, that could be your position at that point in time. I think you have options there for being able to deal with that, and I don't think necessarily that it needs to go to the extreme. I think there needs to be a starting point here, which is a conversation. Maybe you've already had many conversations with Dr. Shanker from this perspective, but if those conversations have not occurred at this point in time, my position here is today that please have those on behalf of agriculture and with insight the information that I presented here today.
Well, I think Mayor Hewitt could probably tell you that we haven't always agreed with Shanker every step of the way, but you know he is making his decisions based on the health of our community and not on things like economic factors. There is no provision for that within the Health Protection and Promotion Act. So that's where we run into a challenge here.
Yeah, and my presentation here, Mayor Schultz, today has not been solely on the basis of the principles of economic factors. I've tried to give a reason as to why I think that the approach to having farmers house their workers on the farm creates more benefit for the current situation than less benefit.
Okay, I just wanted to just clarify because, like you said, there's a lot of misinformation out there, and there's a lot of within the farming community that Mayor Chop issued this order, and I just kind of want to see that you understand that there isn't actually, besides removing Shanker from his position, there isn't anything that we can do to overturn that order.
Yeah,
some acknowledgement from the farming community for me that that's the case.
Yeah, for clarification and on the record, it is not my understanding that Mayor Chop initiated Section 22 order for the farming operation to limit 3 people per house.
Thank you. Okay, any further questions from councillors to the deputation? Somebody like to move to receive the deputation as information? Councillor Martin, seconded by Councillor Van Passen. All those in favor? And that's carried. And is there any further motion that somebody wishes to put on the floor? Going once, going twice. Any further motions on the floor? Councillor Huffman. Oh, you're mute, sorry.
Thank you, Mayor Chop. Well, I guess in terms of the appetite around the table is that, so is it to bring a motion forward to state that, is it in fairness to state that Norfolk County Council does not support the Section 22 order that is issued and request that it be withdrawn? Is that a motion that we're willing to entertain today?
So just for clarity, we're not at council right now, we're at public health, and they are very different in this context. So on On which basis I would need you to articulate that you wish to oppose on record Shanker's order.
Okay, so sorry, I apologize. I said council instead of Board of Health. So I would like to go on record to say that I oppose the current Section 22 order.
On which grounds?
On the grounds that it is exceeding the provincial and federal regulations, and that it's causing undue hardship to Norfolk County. And I have great reservations about the issues regarding food insecurity in the upcoming season. And that is something that we need to take into account. And, sorry, I'll leave it there.
Okay, just if you could expand on the, just took some notes here. So exceeding provincial regulations, food security. The second one was undue hardships. Can you explain the undue hardships?
The undue hardship in terms of the temporary foreign workers that come to this county season after season, and also in terms of the undue hardship, I will mention that there's a financial ramification, but I think in terms of the stressors that this has caused our farmers in the agricultural sector, and that we need to be cognizant of the undue hardship that this has caused them.
Does somebody wish to second Councillor Huffman's motion? Councillor Columbus. Shanker.
Be pleased to second that if that's a motion.
Shanker, would you like to?
Seconder?
Madam Chair, members of the Board of Health, I think for my preference, I'd like to, my apologies. It would be helpful for me to give my presentation because we have the data, and some of the data is factually incorrect, and I'd like to correct that for the record. So if I would have the opportunity to make my presentation. So, I've listened patiently from our members in the community, and the core part of public health is, in fact, having dialogue. But I also think that the dialogue has to be based on the facts and on the data and on the evidence. To start with, I grew up in Vineland. My first memories of childhood is I lived on the research station in Vineland. My dad was in agriculture from the very beginning. My dad was a farmer. My brother is a lawyer, and he's also a farmer. So when I put forth these recommendations, I put them with some knowledge of the farming enterprise, the agricultural enterprise, but also the paramount responsibility to effectuate the health of the 110,000 people who live in this district. I'll get to my formal presentation in a minute. But when we started this journey in March, we expected 500 additional people to die in Haldimand and Norfolk County, 500 extra people, and 1,500 extra admissions to the hospital. That would probably double or triple the number of admissions. We were expecting to exhaust the capacity of the ventilators. We're going to exhaust the capacity of the ventilators in the district, and we would have people dying. We already have had people dying. We've had 31 deaths in this district. There's only one time or another we were 1 and 2 for the number of people dying per 1,000 people. In fact, if you take Haldimand County, which had the most number of deaths, they experienced 28 deaths in 40,000 people. That's as many deaths as they might experience in 2 years in Haldimand County in a car crash. So the reason we had to act as an emergency is exactly what the statute is written for. How do we deal with an emergency that could take people's lives? Now, it's always easy to comment after the fact about, well, was it the right decision or not? The second is, the incubation period for COVID-19 is 14 days. So anything we do, any data that you get today reflects an action that happened 14 days ago. And the third is my informal comment. I'll get to my formal presentation. I have received many phone calls from the wives of farmers telling me, should we even have these overseas workers come? And my answer is always the same. If you can manage them effectively, let's do that. I want to leave you with the number 38% is not correct, and I'll actually go through the numbers with you. But let me start my formal presentation. So Madam Chair, members of the Board of Health, sorry for me speaking so informally, but how do I get the slide deck to work? We not, Andy? Oh, there we go. So it only takes one cough to communicate COVID-19. It's just one cough. That one cough can make the difference between somebody living and somebody dying. How do I get this advanced, Andy? Okay. All right. Well, so we are talking about saving lives. That's the reason I became a medical officer of health. It was about how we can make a difference in saving lives. None of us planned for the pandemic. You know, actually, I came to this job primarily to work on improving the lives of children. But here we are. It's a situation that we all have to somehow get through. So COVID-19 has many potential symptoms. You can have cough, fever, shortness of breath, muscle aches. Those are typical. We're learning more about COVID-19. It has other sort of unusual symptoms: loss of smell, loss of taste, seizure, stroke. We know that it impacts the elderly and the disabled. We know that here in Haldimand and Norfolk County because we saw what had happened at the long-term care facility, but it also affects other people. In Haldimand and Norfolk County, it's affected people and killed people who otherwise were living in the community. People that could have been my older brother. The test is not perfect, and it can miss many people with infections. So all the wonderful things we have in medicine, like the HIV test, we don't really have that. Many times the test is wrong. You can transmit the infection even when you're not feeling sick. So that makes it that much more of a challenge. So one of us is not feel. It's one thing to transmit an illness when you feel sick. It's another thing to be able to get the illness because you have an asymptomatic person. I know this is hard to see. This is a normal lung. You can see the blackness, you can see the spine, you can see the diaphragm. This is the COVID-19 lung. You can see how it's whited out everywhere. It's called the ground glass appearance. When you start getting the ground glass appearance, and when you start getting these x-rays, it's going to be tough to ventilate you. It's going to be tough to manage you in the ICU. So when we think of COVID-19, what are the categories of patients we're worried about? The people that are infected and currently symptomatic, they can transmit the disease, but we know who they are, so we can isolate them. The people who are infected and will get symptoms later, like if I were to get symptoms a couple of days from now, I could theoretically infect every one of you. And then there's the person who's infected but is never symptomatic. So we only know about this group of people, and we'll ultimately know about this group of people. We'll never know about the infected person who never gets symptomatic. So what did Haldimand and Norfolk do? What did the two counties do? And I think they have lots to be proud of. They activated the emergency operations centers, and they did it quickly. Containment of the people who can transmit the disease, and I'll talk more about that. But we contained as much as we could. We built capacity to help acute care hospitals. We expanded the capacity of ventilators, and we were starting to think about how to go back to normal. It only takes one cough. It's just one cough. So the first part is containment. I know I keep saying this, it's sort of boring to hear about it, but it is the best thing we have. It's to identify, test, self-isolate, and monitor adherence. This may not be known. We've been following 3,000 people in the district. 3% of the people in this district have been called at some level by the Public Health Service. We don't talk about it too much because we try to protect people's privacy, but we're always monitoring adherence so that people won't transmit the illness to anybody else. The core of public health, when I treat patients individually in the clinic, it's just them in front of me. I can do everything I can for them. In this context, we have 110,000 people we got to advocate for their health, and it's to identify, manage, and mitigate risk. And I'll talk throughout this presentation about risk. It's actually, risk is not the only thing. As public health doctors, we're not the only people managing risk. All of people are managing risk in every part of their jobs, but the people who we serve we're serving people and this is what we have to do. The pandemic is a public health emergency. It's killed the most number of people in my lifetime. You know, SARS was in the hundreds of deaths, and we're talking already in the thousands of deaths. So what do we do in the public health service? We try to figure out what the problem is. We measure and quantify risk. We try to use all the tools at our disposal. That's education, dialogue, policy, rule, laws, regulation, federal and provincial direction. We enact public health orders, and we rescind public health orders. Public health orders are the most assertive strategy that we have. I would share a couple of things. The public health orders that we've written are consistent with policy. You know, containment. We're trying to make sure that we don't have unnecessary travel, stopping the migration of people, all the things that will get COVID-19 under control, like every other pandemic that's related to an infectious disease. My service is apolitical. You know, when the legislature framed the statute, they contemplated, you know, the legislature, they contemplated this fact that we might be in a situation where that it is not for the determination of political whims, and I don't mean that in a bad way. Politics is a good thing, and I respect those people who put their names forward. But I don't put my name forward to get elected. I took this job to try to make a difference, and the statute gives that guidance and authority and power, and we use it judiciously. You know, we put orders in, we take them away. When we enact an order, I talk to legal counsel because I need to know that what we're doing fits the law. So moving to my second point, what is the current status of COVID-19 in Haldimand and Norfolk? And I'm first going to talk about the people who are in the community. When you go to the grocery store, when you go to the gas station, when you go to the pharmacy. That's one of our first goals in the public health service. So there's a typo here, right here, but there are 206 people currently with testing positive. There are many more that are infected. 31 have died. Some lived in the community prior to death. They're not all long-term care home patients. The deaths are substantively in older people. We've tested 2,200 people. We've tested 2% of the district. And we've tested 1,000 people just in the last 3 weeks. There are 3 testing centers in the health district. I'm proud of that. Working with the hospital and the Delhi Community Health Center and the Gospel in Dunville, we have testing sites for people. The community cases have been widely distributed through the district, meaning this, is there a pocket of people in the community that have COVID-19? I don't think so. I think they're throughout the district. This is a slide I always show. If you look at where we were on April 6th, we were going this way. We could have gone towards the 500 deaths, or we could have tried to contain it. And we tried every conceivable strategy to contain it. So if you believe there's a spike here, there's a spike here, there's a spike here, a smaller spike here. That's one way to interpret the data. Or the other way is to say this is just one big curve. In any case, if you look here, the number of cases have dropped. We're down to less than 1 case a day. And the good news is, not if there's any good news about people dying, and I wouldn't say that, the more positive thing is that these cases we can find a reason for. They were at a nursing home or a long-term care home. I'll talk about the places that are currently on outbreak. The age distribution. It's still the people testing positive are older people, but notice here, we have people in their 50s and we have people in their 40s testing positive. So, and we're having a little blip of younger people, I would say. But overall, we know that the older population is likely to be affected. Geographic distribution. Anson Place is in Haldimand County is the place that's most affected. Norfolk County is only about 9% of cases, and Haldimand County is 30%. I always say this is unverified data. I have to double check it again, but I brought it today to show you the most recent experience. One way to see how well you're doing is the number of people who are on self-isolation, meaning how many people today are staying at home so they will not give the disease to anyone else. What's that number? I know this is a complicated slide, but at the beginning of the pandemic, it was just 10, 20. At the peak, it was nearly 600, right here. 600 people stayed at home. That's a big civic contribution. You know, I would say only a very small number of people pushed back. The vast majority of people, when you said, you know, you could save a life, even when they didn't understand, we'd go talk to them. We're down now, right now, to about 150 150 or so, 175. So we're making progress at containing COVID-19 in the community. So what does that mean? It doesn't mean the risk is zero, but it means that when you go to the grocery store, you're less likelihood to be in contact with someone who's sick. And if you're less likely to be in contact, with someone who's infected, then you're less likely to get the disease yourself. So I want to talk a little bit about Anson Place. It's a long-term care facility and a retirement home. It's had been an outbreak for the past 6 weeks. As I've said, there are 27 deaths. What are they doing over there? What are they doing over there to try to get this under control? Every single patient, every single caregiver is using personal protective equipment for all encounters. They're wearing a mask, they're wearing a face shield, they're wearing a gown. The residents remain in their rooms at all times. I'll talk about how significant a contribution that is. They remain in their rooms at all times, including when they're eating their meals. The Public Health Service, we provide advice to them every single day, and they take our advice. Every morning at 10 in the morning for the last 50 days, I've been on the phone, or 45 days, and so have members of our team. Every single day, we've been on the phone with them. There were people, and this is sort of important, there were people who tested positive who never had symptoms. That's the asymptomatic spreader. That's that person who can give you the illness even though that they don't know that they're sick. Now, luckily, for our good fortune, those people agreed to stay in their rooms. Overall, Anson Place is doing better. That's a good news story. And I actually expect that we'll be able to lift some of the restrictions on Anson Place, that the people will be able to walk outside their rooms. They haven't walked outside their rooms for 42 days. So, we've returned 7,000 phone calls. There are 110,000 people in the district. Our staff has returned 7,000 phone calls. 7 days a week we return phone calls. Dialogue is probably the most powerful tool that we have in the Public Health Service. Whenever I hear about people talk about orders, the most of our gains, and it's true in medicine overall, being a school teacher, being a principal, talking to people usually affects something more positive than anything else. The risk of being infected with COVID-19 in the community is now lower. That I feel pretty confident saying that. When you look at the numbers, and I look at the numbers every single day, and we have a data team, and we're not perfect, but the numbers look better. You're probably safer to go to the grocery store now than you were a few weeks ago. I would still only go once a week. However, this is not the time to be complacent. This is not the time to be complacent. The second wave, the Spanish flu killed more people in the second wave than the first wave. SARS killed people in the second wave, not as much. SARS had a second wave. So where are we now? Community risk, I think we're doing okay. It's not perfect. We're going to see a few cases. Hopefully, we'll see it. But I think right today, because that's all I can tell you, I think risk in the community is okay. The two biggest risks we have are travel and congregate settings. And I would say prevention is better than responding to an outbreak. So that goes to everything we do in public health. We'd sooner deal with the problem in advance, before it becomes a problem, than deal with the consequences after it happens. Travel is a vector of transmission. It's a risk that can be managed with an assertive public health plan. Travel is a risk. And I've showed this slide before, but this is our own health district. We had 10 travel-related cases. If you notice, they all came at the very beginning. They all came at the very beginning. This is an outlier, and I can't reveal the confidence of this outlier. But if you look at travel, right at the very beginning, this was the first case, and that was travel-related. That's why we put a lot of energy into travel, because it's not the only reason we have COVID-19, but it's a reason we have COVID-19. And managing travel-related risk is something that's a priority. In fact, the government recognized that because somewhere around here, they made everyone go on self-isolation. So what happens today if you travel from Canada, from the United States or another country to Canada? You come in an airplane, travel's already restricted. When you cross the border, you have to provide basic contact information. You have to give your passport. They screen you at border services. This may not be known. Many times they flash your passport. They already know who you are at the passport when you cross the border. And there's a mandatory self-isolation. They tell you, I have the federal documents I can show to the Board of Health members, but they tell you that you have to be on self-isolation. And then somebody from the government tells you you have to answer your phone. Not only do you have to give a phone number, but you have to represent that you'll answer your phone during your self-isolation period. That's what happens today. It happens to every single person who returns to Canada. So what is the government trying to do? What is the federal government trying to do? When you depart a foreign country, you transport many times by an ambulance, by a transport vehicle like a bus, to go to the airport. And then and airports are always high trace areas for transmission because people come and go. And then you travel by airplane, which is a contained space. And then you come to the airport in Toronto, if you're flying in Toronto. And then you take a bus or many times to where you're going. And then you have to, so each one of these things gives you risk. And then the only place we get a chance to reduce the risk is the self-isolation residence. That's why people from Canada who return from Florida have to spend many times 2 weeks in the basement. When my daughter comes back from Puerto Rico in June, and I hope the travel restrictions will, that I will spend 2 weeks in the basement because my wife will not let my daughter spend 2 weeks in the basement. So we have to separate as a family. Not the end of the world. It's a hardship, though. And then you return to the community. So that's the pathway that we have for every person who comes back from Canada. It's no different. So what is a congregate setting? If you notice, the dormitories were closed, right? And why were dormitories closed? One of the first things. Remember, my mom remembers the polio scare. Why dormitories were closed is because they're congregate settings. They're places where people share kitchens, bathrooms, and common areas. And there's an infinite list of congregate settings. One is a long-term care nursing home. Then some that you may not think of, a homeless shelter, a women's crisis center, a correctional institution. In our district, it's a bunkhouse. So we've heard people say, well, you just have to follow the federal guidance. This is what the federal guidance says. Like everyone adapting to COVID-19 pandemic, temporary foreign workers and employers are expected to follow the latest public health and safety requirements and guidance from the Government of Canada and from their respective provincial, territorial authorities and local authorities. That is the way the statute was constructed. And that is the federal government guidance. So the argument that somehow that the local health district has done something extraordinary is not true. In fact, my colleague in Windsor has done something. He's done something differently. But for us in this health district, bunkhouses are a big deal. So what's the typical family situation? The typical family situation has got, let's say 2 parents, 2 children. They have 2 bathrooms, 3 bedrooms, a kitchen, and a congregate area, a living room and a rec room. In that situation, if one of the parents had to self-isolate, they might go to the basement or go to a separate bedroom, use a separate bathroom, and maybe their meals would have to be provided by another member of the family. Maybe if it was me, my wife would probably leave the food at the beginning of the basement, and somehow I'd have to make a little fridge downstairs, like my kid's college fridge, and we'd somehow get through that. In a congregate setting, this is what happens. You have 20 people, they have 3 shared bathrooms, they have bunk beds, they have 3 kitchens and common shared areas. If you have an outbreak with one single person, you can have the entire bunkhouse being infected. And if this is a college dormitory, the same thing. If this is a nursing home, that's why in the nursing home at Anson Place or any other, the people were confined to their rooms. And it's not something that as doctors or public health officials we ever want is to isolate people. So that is why congregate settings are a high priority. That's not just my perspective, that's the province's perspective. We put lots of energy into congregate settings, including homes for the aged. So where are we in Haldeman, Norfolk County? Well, we have an outbreak at Anson Place. We had one at Norview Lodge. We had one at Crescent Care. We had one at Parkview Meadows. And just recently, Norfolk Hospital Nursing Home is an outbreak. There are people, two residents at Norfolk Hospital Nursing Home who are COVID positive. Those people are not confined to their rooms. Every single person there is confined to their room. They get their meals in their room, and if no one else gets sick, in 14 days we'll release them. Anson Place, Parkview, Cedar Crossing are retirement homes. We've had cases at correctional facilities, and despite what has been said, we've actually had to investigate outbreaks at agricultural residences. We had 4 of them this year. We had 4 of them this year. Last year, we had an outbreak of an infectious disease at a farmhouse we had to isolate. Now, the Public Health Service, we try to do everything quietly. That's why you didn't hear about it, but since it's come to the forefront, so we are following this item, and the people we had to quarantine suffered last year because they had to be quarantined. So what are we doing at long-term care facilities? Well, we're doing something extraordinary. It's extraordinary. We're testing every single person in the long-term care facility and every person who works there. Now, talk about doing something assertive. As a doctor, would I test somebody against their will, or would I tell them just doing the test? These are extraordinary things that we're testing everybody at these facilities, and in our health district, we're done. We've done that part of it. So we have an understanding of what's going on in our district. So why are bunkhouses at high risk for COVID-19? Why does the federal and government give us this discretion to make local decisions? Well, because we're local communities and we have to make risk locally. And the estimate I got was that we had 450 bunkhouses. So we have 3 hospitals, which are congregate setting. We have 19 long-term care and retirement homes, and we have 400 bunkhouses. My understanding is that there are some agricultural enterprises that have more people being housed than at the hospital. So when we think of risk, that is a risk. The second issue is that bunkhouses are related to international travel. So we already know that international travel has been a problem. In fact, the first 10 cases in this health district were related to travel. And then we know that these are congregate settings. So this becomes high risk. This becomes a high-risk situation. And we want to welcome agricultural workers. My dad worked in agriculture all of his life. My dad's still alive. And I grew up in the county of Niagara. And I am personally cognizant of racism and bias and prejudices. So we want to welcome agricultural workers. When people call me, I don't say don't have them in your household. When the farm wife calls me, I don't say that. These are people, they're looking for a livelihood. We just want it to be safe. So why is Haldimand County different? Well, here's the numbers. In Essex, they have 8,400 people, but they have 4 times the population. In our district, we have 4,264 is the maximum, but we have 110,000 people. That's 4% of the population of the health district. And when you include Norfolk County, it's even a higher percentage. We're number 1. We're number 1. And if the health unit didn't manage risk, we wouldn't be doing our jobs. So that's the reasoning behind it. So what are the 2 things that Haldimand and Norfolk do? First of all, the Ministry of Health wrote me, and I can give you the quote. They were using our guidance documents to help other people effectuate the plan because the government announced it, and 4 days later, there was a very short time frame. But what is different about Haldimand and Norfolk County? What's the difference in our health unit? Well, one, we've taken the proactive approach and asked for the approval before the people get here because we want to prevent illness. We don't want an outbreak in a bunkhouse, and I'll talk about what the problems for the people who live in a bunkhouse are when there's an outbreak. And number 2, during the self-isolation period, that 2-week period of time when you can't work, we have said that you have to have, if you're going to use a bunkhouse, then use only 3 people in the bunkhouse. If you use a hotel, they can use the people, whatever the requirement of the hotel. Some people have used trailers. Now, the county of Norfolk actually offered a program where people could come and use hotels, and the county would front the payments. The county would front the payments, so people could effectuate a self-isolation plan. Like everything else, we try to work in the background on this. So that was always on the table, and actually many farmers have actually used hotels. One farmer, I think, booked an entire hotel. All of his workers got here, and so it is doable. If I want to share a little bit about risk, I always talk about risk. I know I say the same thing over and over again. And when the pandemic is over, maybe you can demit me from the schedule here. But these are all the bunkhouses in Norfolk County. If you look, they're concentrated around in this area right here. There's the reserve that's close to us. We have citizens in our district that are indigenous to us. We have very relatively few in Haldeman County. So when we think of congregate settings in one concentrated area, it's just that much more of a challenge. So this is the numbers. There were actually 293 applications made by agricultural enterprises, and 2,600 workers have been reviewed and approved. Now, the number that we were actually expecting, the latest numbers is, and I'll get the number here, 3,521. So we've already approved 2,600 workers. Now, is there a backlog? You know, the health unit staff, in fact, have been reassigned to this function. So of the workers, there are 1,900 that are here, 1,600 are working, 285 are on their self-isolation plan. Of the 293 plans, 282 were approved. There are only 11 pending. And do they happen quickly? The time from application to approval on average is 3.5 days. Some people get their approval the next day. And there's a process to help people get their approvals. Our goal is to effectuate a self-isolation plan so that the risk is down to the level of the person going to the grocery store. So when you see a migrant worker, that you can feel confident, like if people, because they face stigma and prejudice as well, that they're doing everything like every other person who comes back to Canada. There are residents of bunkhouses who did get sick this year, and the public health unit had to conduct outbreak assessments. And in some cases, we actually had to extend the self-isolation periods. If there were 20 people in the bunkhouse and someone got sick, that would be a big outbreak. If it's one person and they're self-isolating with one other person or two other people, or better yet, isolating alone, then there's no chance of spreading it to somebody else. I know this is a very hard thing to say, but when you put 3 people in a self-isolation residence, if one of those people gets sick, the other 2 people have to serve out another 14 days of self-isolation. So 2 people are suffering. They're put at risk. We would never do that to our own families. I don't think we would do, and I'm going to talk about that a little bit later. So what are the consequences of an outbreak at a bunkhouse? Well, first and foremost, the people who live at the bunkhouse experience illness. That's not compassionate. Even though it's a mild to moderate flu-like illness, it's still not a fun thing to have, days upon days of illness. People exposed to the COVID-19 person are also in self-isolation. And if you have 12 people in a bunkhouse during the self-isolation period, it could be 12 people, it could be 20 people that are isolated. And many will require testing. The test is to put a piece of a swab in your nose. It's not fun. Farming activities, and this is less important, but it's still important. Farming activities will be curtailed due to the workers. My dad was a farmer. You need the people to do the work. So farming activities will be curtailed due to workers, due to the lack of workers. The public health staff on average will spend 4 hours to effectuate a public health plan. Because when somebody is sick with COVID-19, not only do we have to call them, we have to call all of their close contacts. We have to call their boyfriend or their girlfriend or their children or their mom, or whoever they're in contact with, we have to contact, put them on self-isolation. Remember, just the numbers, 3,000 people in this district were actually on self-isolation. And the COVID is likely to spread to other districts. This is not theoretical, this is true, and I'll talk about that. So, this is the outbreak in Chatham. You know, my wife's family's from Chatham. It's not that far away. There was an outbreak at an agricultural enterprise. I spoke to the medical officer of health. It's been a challenge for sure. There were at least 51 cases of people who were tested positive. There were 100 people put on quarantine or in self-isolation. 100 people. And there were 300 people tested. And the outbreak actually spread to other health districts. There are other bunkhouses that have people sick with COVID-19. This is in British Columbia. During the self-isolation period, 8 farm workers were infected with COVID-19. And in Kelowna, BC, they actually had to close an agricultural enterprise because they had outbreaks there. There are other outbreaks as well. The meatpacking plant, the Cargill meatpacking plant, which also depends on overseas workers, that closed 2 weeks. Apparently, they're a big percentage of of food production in Canada. So managing the risk may in fact actually keep the food supply functioning. This is I know this is a very deconstructionist idea. There's not a separation between economic health and human health, because the greatest amount of capital is actually human capital. Every school teacher knows this. Everyone who works in education knows this. And I'm a university professor. If you have healthy people, they will make more, they will build the enterprise. And if we have healthy farm workers and we have less outbreaks, we will continue to produce more food. So prevention, that's the most important thing in public health. You know, and I hear this argument a lot, which is, well, why are we asking for this in advance? Well, this is consistent with everything else we do in the health unit. You can't open up a restaurant before you get because you could kill somebody if you give them food poisoning. Hairstylists, pools, spas, daycare centers, small water systems, water haulage, tattoo parlors. The legislature, this is what the legislature wanted. People wanted us to make sure people were safe. And they require prior approval and post-approval monitoring. I know this may sound unusual, but we send people out to inspect tattoo parlors and restaurants and other things on a regular basis. And if in fact we think that they're not safe, we put up a plan to remediate that. If they continue to be unsafe, we tell them they can't continue in that business because people could suffer. So this is what British Columbia did. We're not the most conservative and we're not the most permissive. We're somewhere in the middle. British Columbia requires that all temporary foreign workers go into a government-supervised hotel. This is from the newspaper. That's from the government website. I didn't put this here because I thought it was just overly oppressive. New Brunswick has said they don't want any more farm workers. I don't agree with that. So different provinces have done different things. So what happens for someone who's a farm worker? How does that differ from anyone else here in Canada? Well, same thing, baseline risk. You go to Florida, you have additional risk because you have to travel to the airport. You have additional risk at the airport. You get on this closed environment called the airplane. You have additional risk when you go to the Toronto airport. You may have additional risk if you take a public transit to your home, but there is a difference. And public health service has to make differences based on the populations we serve. So some people serve in a hotel room. That's where the agricultural enterprises choose to place the person. Some people put in a bunkhouse. The only restriction is we say you can only have 3 people. Or some people put them in a trailer. That's okay too, you know. That's okay. We're trying to give people options. What more in a free society than give people options? And then they go to the larger bunkhouse. The only thing that's changed is the fact that we've asked people to go we've restricted this to 3. If you go to a hotel, you can only stay with the number of people in the hotel. And many farmers have actually got hotels because it's just more convenient, efficient. This is the standard self-isolation plan. This is what you and I or anyone else coming back from Florida would have. One person goes into the self-isolation residence. If they become sick on day 13, what happens? They have to serve another 14 days of self-isolation. There's 27 days of work lost, if you want to think it from an economic point of view. The only one who suffered because they got ill was the person who was in self-isolation. Well, what happens if you put 2 people in self-isolation and one person gets ill on day 13? Well, the person who gets sick has to have his self-isolation period extended. The guy who's not sick, the man or woman who's not sick, has an extra 14 days of self-isolation. We've added 14 days of confinement to somebody solely because they have to share a self-isolation residence with somebody else. What if that's 3 people in the self-isolation residence and someone gets sick? We're adding self-isolation period to 2 people who don't need it. 28 extra days. This actually has happened in our health district because we've had people get sick during their self-isolation period. So the issue is not purely economic, it's also compassionate. And if you have 4 people, it's 108 days lost. If you're running an agricultural enterprise and you lose 108 days worth of staff, that's going to be a challenge. But I really want to share this with you. I think the people of Haldimand and Norfolk County actually would probably be more moved by this. I spoke to the doctors in Trenton, where when Canadians were stuck in China or stuck on the cruise ships, this is what the federal government did. It flew them to Trenton instead of the Toronto airport, flew them to the military base, took them to a hotel, and they stayed in the hotel. And who was in the hotel? They only stayed by families. If you were single, you stayed in the single room. If you were with your wife and kids, you stayed in that room. There's no one at Trenton who's asked to stay with a stranger, someone they had never met. And if that's what we want to give people from Canada, then I think that we should treat migrant workers the same way. That we shouldn't put, and remember, when you put 20 people or 15 people in a fixed physical space for 14 days, where they can only travel around the perimeter of the property, it's a difficult situation. It's a difficult situation. And how effective will self-isolation be if there are 15 of you in a room? How effective would it be in my own house if there were 3 people in the basement? Would I really be able to keep 2 meters away from everybody? It'd have to be well choreographed. It wouldn't happen. So I want to shift to something that I think is also important. When we return to normalcy, we have to think of how are we going to return to normalcy. As doctors, as public health officials, we wonder about this. Like, if you ask me what is the #1 deprivation, it's children not going back to school. My own children are suffering at home. I keep them in the house. They don't go out. They don't go to the grocery store. I try my very best to keep them at home. So right now we're isolating by family with some exceptions. You can hang around with your family, but everyone else you stay 2 meters apart. Well, that's not sustainable. That's just not sustainable. So we got to think of how do we isolate among 2 families. I haven't seen my brother. I haven't seen his new farm. I'd like to go see it. I'd like to see my sister-in-law. But when will that day come? There's still a bubble. There's that bubble. And then how do you self-isolate among small communities like churches and parks and retail? And then how do we get to this point where we self-isolate among larger groups? That's the public health challenge. And we got to know the right time to do it and how to do it, and what's a priority and what's not a priority. Now, for my own personal preference, it would be schools, things that benefit young people and children and young families. I know when we talk privately, I say that all the time. It's the children who are really suffering from this. Many children are deprived of, I was talking to a colleague of mine, and he was saying that his 5-year-old grandchild does virtual education. And I was like, what on earth is virtual education when you're 5? It's one thing when you're 18. It only takes one cough. That's where we're at. It only takes one cough. So what if containment is not successful? And I commend the county of Haldimand and Norfolk, both counties, for really working on this. They took if we start to get another wave of cases, what will we do? Well, we're ready. We're ready at some level, and the Board of Health here and some members of the Board of, I think Ms. Martin came. We have off-site treatment facilities. It will build capacity. If we have to deal with a surge of cases again, we have an off-site treatment facility in Haldimand County and an off-site treatment facility in Norfolk County. Marlene, if you could call Laura Jean for that. The hospitals have a limited stock of ventilators. We know that. And so what can we do at the health district to improve that? Well, we have done things. We've found 15 basic ventilators in the health unit. We found them through the county gets held onto them. We have twin automated devices that can build a bridge to ventilators. And this is a type of ventilator. It's a type of automated bagging device. And when my assistant Laura Jean gets here, she'll have it working, or you could see it working after. But we'll have 50 of these, and a gentleman in Haldimand County made them for us. Yeah, this is actually an improvement over the MIT ventilator. And we'll have 50 in the district. So if it ever comes to that, if it's not for this pandemic, for the one after, we'll have something to show. Go ahead, Laura Jean, see if you can get it to work. So, breaking the chain of transmission. And this is just one transmission. A motorcyclist comes here for a day trip. He coughs and infects the gas station attendant. The gas station attendant infects his spouse, infects the grocery store cashier. It goes to the cashier's children, the parent of the grocery store owner, the parent of the grocery store cashier, a spouse who then works as a healthcare worker, a long-term care resident, and we have death. So what are the people of Haldimand and Norfolk County doing about it? Well, here's one example. Here's a woman. She goes to her hairdresser. She coughs on the client coughs on her and infects the hairdresser. she infects the spouse who works at a long-term care facility. He goes to treats a resident at the long-term care center, and we have death. And what are the people of Haldeman and Norfolk done? Hairdressing salons closed. It's broken the chain. The reason I show that is, So these are the sacrifices of small business owners. You know, the hairdressers, daycare centers, they're closed. What other operations are reduced? Well, funeral homes. People might not those that you can't have a funeral with anyone you want. It's limited to 10. Restaurants, they're closed. They're working reduced capacity. Dentist offices and food service enterprises, they've all made a contribution. They've lost revenue. They've lost staff. They've had to invest in personal protective equipment. They've changed family dynamics and roles. And what about government support? Well, there is government support for sure. There is government support for sure, but it's not enough. You know, for agricultural enterprises, they get $1,500 for every worker to cover their quarantine costs. What are sacrifices families have made? Well, there's no schools. There's a lack of social interaction for young people. There's no sports or recreation. Missing milestones. My daughter's graduating from college on Saturday. 4 years of college, and we're going to see it virtually. I'm not flying to New York. Weddings? Weddings are done, at least as far as I understand. If you've organized a wedding, put it off. If there's a birthday party, can't go, right? You can't go. So these are the sacrifices of families in Haldeman, Norfolk County. This is an incredible sacrifice. 3,000 people, more than 3,000 actually have served out self-isolation. And they're by themselves. And then there are people, what are the sacrifices of the people sewing? They've made masks and gowns. People are sewing. There are 150 women in this district, mostly women, I'd surmise, who are sewing masks. Yesterday, a man came and dropped off gowns. Apparently, there are men and women in Haldeman County sewing gowns because they're in short supply, and they're in the public health services. What are the sacrifices of people in long-term care? This is not well understood, is that they're isolating in their rooms. Some of them are isolating in their rooms for weeks. So there are no visitors to the nursing homes. You can't visit your grandmother at a nursing home. Their meals are in rooms. There's reduced recreational activity. So this is what I think. There will be more pandemics in the future. We'll demonstrate this at the end. We'll show it at the very end, all right? Because there will be more pandemics in the future, and our approach at the Public Health Service is to use every appropriate resource to keep the community safe. And I think this is a positive message, and I'll say this again. I lived through the HIV crisis. I lived through it. When I graduated as a specialist, everyone who had HIV died of HIV. And today, it's just like any other chronic illness. I lived through H1N1. My son had H1N1. Our culture went through SARS. This is going to be a tough time, but I do think that working together and sharing in the sacrifices, the Haldeman and Norfolk County has formulated a defined response. Madam Chair, members of the Board of Health, I'm sorry for speaking at such length. This occupies every hour of our day, and I'm happy to answer any questions.
Thank you, Shanker. Okay, so just to clarify, Councillor Huffman, your motion that is on the table, I have as the following. That the Board of Health requests that the Medical Officer of Health repeal the March 24, 2020 Section 222 order due to its adverse impacts upon the agricultural sector, specifically for the following reasons. 1, it exceeds provincial and federal regulations. 2, the order creates an undue financial hardship on farmers. And 3, the order contributes to food security issues. Is that your motion?
Yes.
Okay, and Councillor Columbus, you were the seconder. Any questions for Dr. Nasathari? Councillor Columbus.
Thank you, Doctor, for that detailed presentation. With respect to infections this year, 2020, how many actually positive coronavirus cases was there in 2020 that were diagnosed and treated?
Yeah, so we don't actually know the number of people that are infected, because we don't know the number of people who are asymptomatic infected. But the number that are recognized is 206 as of today.
These are migrant workers?
Well, there are migrant.
I'm just talking about migrant workers in 2020.
Yeah. So in this health district, I don't know if I want to share the information about individuals. I can talk to you privately maybe, but here's the challenge, and I have to answer this obliquely. When somebody presents with symptoms of COVID-19, we order a test on them. Regardless of the test, we put them on self-isolation because the test is not perfect. In fact, it misses a number of people who actually test positive. We know that we know that there's an outbreak at a bunkhouse that's involved at least 50 migrant workers in Chatham. We know that there's been outbreaks in British Columbia. We know that there are COVID-19 cases at bunkhouses in another district close to ours. So I guess without having to reveal any confidences, because the numbers are small, I would say that our bunkhouses at high risk, they are. Will there be an outbreak at a bunkhouse? I don't know, but we're doing everything we can to boil them down. Unfortunately, I don't know how much more I can comment on that, but are bunkhouses at risk? They definitely are at risk. We've already had an infectious disease outbreak of something as contagious last year at a bunkhouse. So it's not a theoretical risk. It's a real risk. It's actually happened. But I don't want to violate the confidence. If I start talking more, I think I'll violate the confidence of somebody.
Well, it sounds to me like it's pretty limited. Do you have any concern about the decline in agriculture production and the food supply potential shortage in Ontario? Fresh produce?
I do actually. My job is to balance these competing interests. And I appreciate our discussion on Friday. So at one level, I guess from the strictly public health point of view, I'm supposed to advance the public health mission, the health of the 110,000 people living in the district. And as you can look through the numbers of the health unit has already approved 30, I think it's 2,600 and something, and the expected arrivals are 3,521, and we have approved virtually 95% of the applications that have been approved. So if in fact agricultural enterprises want more workers, we're willing to look at those applications and approve them. And in fact, we approve them on average within 3.5 days. Am I concerned about food? Absolutely. Am I concerned about the health of older residents of Haldeman and Norfolk? I am. Am I worried about these outbreaks getting more and more frequent and more people dying? I am. So it's always trying to balance all these competing interests. That's the core of what we do at the Public Health Service. The other thing, and I think it's a delicate issue, the difference between practicing medicine and running and trying to manage public health is when I practice medicine and when I see patients in the clinic, I see them as individuals. I try to make the best decision for that one person. So if I think a person needs a test, I order the test. If I think the person needs to be hospitalized, I admit them to the hospital. No problem. It's easy enough. When you run the public health service, when you manage the public health service, we have to look at what benefits the 110,000 people. And sometimes certain things that are disadvantages to the public, to one individual, is advantageous to the population. So I put the example of the woman who's a hairdresser. It's a real story. She called me at the very beginning of the pandemic. And she said, she was very respectful. She said, how am I supposed to make a living? How am I supposed to make a living when I depend on tips for my income? And I went through it and I said, well, I hear you. I recognize that's a challenge. But it also means that perhaps that your grandfather will not get COVID-19 because you're part of that chain. And a hairdresser can see 10, 15 people a day in close quarters, right? And they can share respiratory droplets. So I am very concerned about food and the food production. I think the data would suggest that 2,600 of the 3,200, sorry, my eyes are not perfect. 2,600 of the 3,500 are already approved. We will approve them as we get the applications through. There's some other complexities, and these are hard, these are quantitative complexities. One is you have to balance the risk of risking an outbreak and closing your agricultural enterprise down versus reducing the risk in the self-isolation period to the point where the risk is of the background risk of the people who live in the community. That's a trade-off. So if you put 20 people in a bunkhouse, you're more likely to have the self-isolation period fail, and you're more likely to lose agricultural workers early. On the other hand, if your bunkhouse is safer or less likely to have background risk, then you're more likely to keep your agricultural enterprise functional. That's a quantitative risk. Secondly, certain countries have embargoed, in my understanding, and I can look at the data a bit more, but it's just not Canada. Some people don't want to come. Some countries apparently have embargoed their workers. So it's not, I think to say that, and we are conservative. At Haldeman in Norfolk County, I'm very cautious. It's that balancing act between those competing set of priorities. I'm sorry to have been so long-winded, Mr. Columbus. I was long-winded on Friday as well. My apologies.
One last question, Madam Chair. In my ward in particular, and I think the Waterford North Townsend Township, tremendous amount of large agricultural operations, and these people are putting a lot of pressure on councillors. They would like to know why the agriculture community was not involved from the outset to put someone on a committee to deal before the 3-person limit was put on so that they could have been heard.
Yeah,
was that a mistake by the health unit, do you feel, that they were not included or consulted in our major #1 economic driver?
So I think that there was, so I could answer that question in a two-part way. I think Marlene and the team, I do my best to answer calls upon calls. As you know, I answer calls all through the day and all through the night. I think this is really a policy difference. This is fundamentally a decision that, I used to treat people with ALS, and one of my jobs is to tell people things that they don't always want to hear in the first instance. It is a policy decision and a public health policy decision. And the reason I chose 3 was for many reasons. One was the government, our policy has always been 5. No more than 5 unrelated people should not be in a residence together. That's our policy. The advice that we give people typically from Canada is isolate by yourself, no matter how many people see. The only time that we would really give that exception, and it's very rare, is if the husband and wife, or it's more common like a child, where you have to give the child their parents. So I would not, we at the Public Health Service, and I personally in my professional practice, would not accept people isolating in groups of 3, in large groups. So, and then the balancing act, which is that farm and food is important. So we didn't pick 1, and we didn't pick 5, we picked 3. It's a judgment call for sure. Every time that you increase the extra person, you increase the risk of the self-isolation residents not being successful. And it goes up exponentially. It's a big risk. And every time you add an extra person, that means you also give potentially additional people to serve self-isolation. So you're increasing the quarantine period for primarily a reason to have more people in the self-isolation residence. So that's how I came up to the number 3. It is in part compassionate. I think that putting people in a self-isolation residence who have no previous relationship with each other, I think is also not consistent with compassion. So I guess in a short answer, my job is to try to balance all these competing interests, recognizing that they're not always popular. They're not always the most popular decision. But I would share that 2,600 of the 3523 have already been approved. We've approved 95% of the plans, and we will continue to approve the plans in a timely manner. So sorry for being long-winded, Mr. Columbus, but I'm happy to speak again.
Thank you.
Councillor Ravitz, sorry, and then Councillor Shelley.
Thank you, and through you, to Dr. Nessathori. I want to make sure that our conversation today, has some structure. We've bounced around from some deputations. I wanted to make sure you indicated you'd like an opportunity to address those deputations, and I don't know if that has necessarily happened.
So you have a question?
I do.
Okay.
I'm asking him if he's had an opportunity to respond to the deputations.
Well, he's had a long time to be able to respond, so I'm sure he's got in
Okay.
what he wanted to say.
So we haven't necessarily had that response to those deputations. I want to make sure you had an opportunity to do so. I know you spoke informally. We had the presentation, and now we're discussing Section 22 order limiting.
There's a motion
3
on the
persons per
table. Do you
bunkhouse.
would you like to speak to the motion that's on the table?
I would, and I'm going to continue to attempt to do so. So getting back to the Section 22 order regarding the 3 persons per bunkhouse, which is what we're discussing now, I'm hoping we're going to have an opportunity to discuss those other orders or those other deputations. Apologize, got interrupted a few times. My question, I understand from a perception of compassion, not having strangers occupy, a single residence. But from our farming community and what they've articulated to me and what I'm posing to you now isn't there also an understanding that when you're working in a migratory capacity, you're going to another nation, you're bunking with individuals already, arguably a season can last longer than 108 days. There has to be some acknowledgement that these individuals would be residing with members outside of their family unit. And what I'm asking for is, respecting the multiplying effect of having more individuals in that self-isolation. Is there not a more permissive number that you would consider outside of those 3 persons? And have you had any feedback from the farming community or those migratory workers themselves? To that effect, that they would be comfortable with having a larger number than 3 during their quarantine.
Can I jump in just with one thing, Shankar? I just want to ensure Councillor Rabbits, and I'm sure you probably already know, but this is also another misconception that has been spread through the public, and I just want to take the opportunity to clear it up. The 3-person rule is only for the quarantine period and not after the quarantine period. It's only during that 2-week period. Okay?
Yeah, so we're not, it's about balancing risk versus benefit, for sure. The people after they finish their self-quarantine period are free to live in the bunkhouse as they would normally reside. It's only for that self-isolation period. So when someone arrives at if someone comes back from Florida and they choose to self-isolate at a hotel, they would stay at the hotel, they would decline housekeeping service, they would get their meals delivered. Someone goes, and then after 2 weeks, they would return to the community. If someone goes to a self-isolation residence and that's a hotel, which many farmers have put forth, that's what would happen. If it's at a bunkhouse, they would serve out the self-isolation period for among the 3 of them for the 2 weeks, and then they would go on back to the bunkhouse. They would go to the regular bunkhouse. When we started this, when this was all started, we had a very short time period. The real fundamental issue is about risk. There's a compassionate reason for sure, and it was my judgment that spending extended periods of time with someone who's not your family is probably not the preferred option. But the other part of this is the fact that when a bunkhouse self-isolation period fails, when somebody gets sick during those 14 days, that the 2 other people will ultimately have to spend an extra period of time in quarantine, and that weighed on my decision making as well. It's an exponential relationship. So when you add an extra person to a bunkhouse, and 3 to 4, and I have slides on that, I'm happy to share privately as well. We can actually calculate that risk out.
I will attempt to ask again if it's permitted. But I did want to have you afford an opportunity for you to address the deputations. I know we're discussing a motion, and we've had some informal presentations. I'm unaware of actually how much you actually got through in your presentations there, because when I'm looking at the agenda, You know, we've got MOH COVID-19 update. We have overview of social distancing practices. I'm unaware if we've even gotten through A or B.
We haven't. We're just on
my question to you is, have you had an opportunity to get through both of your presentations? And have you had an opportunity to respond to the deputations? And if not, hopefully we can have that this meeting.
Sure. Is there a specific, the main thing I wanted to talk about social distance.
If I could, as the chair, I would like to deal with the motion that's on the table, and then we will proceed and we will discuss. Shanker can provide a further update. You can ask further questions. But given the highly sensitive nature of this particular motion, I'd like to stick with what we're dealing with right now, if that's okay.
Will there be an opportunity for a debate after this question period?
We are technically in the debate portion.
Okay, well, I would like to state my position that I would like to see a more permissive policy with regards to Section 22 order. And without having some constructive dialogue to that effect, I cannot support the order for the reasons identified in Councillor Huffman's original remarks, tabling the motion. I have not heard that there would be further consultation. I haven't heard any benchmarks when this order could be rescinded. And, maybe that's my question, Dr. Necessary, is when we're looking at the new normal and returning to a new normal and adjusting to the reality that now is the new normal, today and tomorrow, when can we expect this order to be dialed back, or when can we expect it to have some more an ability to soften this motion? And I haven't heard that from your presentation today, and right now it's not part of the debate, so that's why I'm bringing it up.
Sure. So, I appreciate the question. We review we're in a public health emergency. And it's like every other emergency in medicine or clinical practice. How do you make the best decisions based on the data that you have? When I look at orders and I look at other things that we offer, we review them on a regular basis. When we think that we have a bit better control, then I think we can review those orders. The number 3 versus 4 versus 5 versus 6 versus 7 versus 8 versus 9 versus 10, each of them has a quantitative risk. And that is in part how we make our decisions. So, that is why I would stick with 3 for today. Is there a day that we can withdraw? Like we can withdraw the order? Of course. There are days we can modify the order. But I think the current situation requires us to keep with 3 for now. Are these easy decisions to make? No, I don't think they're easy decisions to make. We face, in this role, we face individuals who don't want any migrant workers at all. There are people who call me and say, I don't want any migrant workers to come to Alderman or Norfolk County. And I always say, well, that's not the way, I don't agree with that, because we need to support enterprises and support these people who come from overseas and depend on the money, the earnings, the remittances to keep it going. And then we have people who think that there should be no restrictions at all or limited restrictions. And so we try to find that balance. My judgment today is that I think 3 is the right number. We've already processed 2,600 migrant workers. We've already processed applications that have permitted 2,600 workers to come. The other thing I would ask is and this is a question, is that the Public Health Service and the people who work with our team, the 100 of us, have worked tirelessly to bring in part to bring these cases down to a more manageable level. We were at 21 cases a day at our peak. We're down to less than 1 case a day. And many of those actions relate to things that aren't always popular, calling people to remind them to remain on self-isolation. When people get testing, to tell them that they have to be on self-isolation. And so I think that our team wants the continued support of the Board of Health. We're doing our very best to keep the community safe. We're continuing with all the other activities that the Public Health Service has to make as best as we can. I think at the end of the day, there are judgments we have to make, and as a medical officer of health, have to make the best judgments based on what we think is keeping people safe. In no way do I want to diminish your arguments, which are always, but we always review the data and we try to make judgments based on the data that's currently available to us.
Okay, one thing I am going to add is, especially given the heat that's been on me with this, I am going to want to participate in the debate, so I will have to pass the chair over to someone at some point, so we're all aware, because it looks like everybody maybe has something to say. So I was actually going to pass it over to you there, Councillor Michelli, but looks like your hand's up next.
Oh, thank you, Madam Chair. I will act as the chair when that time arises.
Okay.
Dr. Nisathere, I guess I'm just going to piggyback a little bit onto Councillor Rabbitt's question and your response, sorry. What conditions or circumstances would have to exist for you to consider lifting the order or changing the number of workers per bunkhouse?
Yeah, so, you know, I've been thinking about this too, because it's just not for bunkhouses, but for other activities. And we have a lot of things we're doing to do work to try to contain COVID-19 in the health district. I think as we progress through the season, we can see how many seasonal residents, how many agricultural residents that have of outbreak investigations or actual outbreaks. We know we've had to do 4 up to this point. So if 4 remains the number for the next 2 months, then we might change that. If we get another 15, then it might require us to stay with it. So that's one, and we use all sorts of different metrics, so that's one metric. The second metric would be that are we seeing a spike in COVID-19 beyond the community? Because of the chain of transmission. Chain of transmission happens like once people serve their self-isolation period, they all join the community, that broader community that we have. And if we start seeing additional spikes of secondary cases, then I would stick with it. If, on the other hand, that we don't see increased spikes of cases, that might change our view. We might look at the rolling average of the number of cases. So that's a data point that we do follow, which is over the last 14 days, how many cases do we see on average? So that's another data element. Another data element that we might use is to also look at the number of people currently on self-isolation, and that's going down. That's going down. So that's a positive metric. So I think that every week, we have to make a reevaluation of where we are as a health district. My hope is that these restrictions do not have to continue, like for beyond Section 22 orders, that they don't have to continue indefinitely. But if we don't get control of this, they will continue over and over at additional periods of time. I hope that answers, or at least provides some context.
Thank you, Dr. Nisathere. So with that in mind, would it be reasonable for members of the farming community to perhaps expect weekly updates on exactly what you just mentioned about checking on the rolling average and making another revision or review of the judgment call and then perhaps acting from there?
Yeah, you know what I was thinking? We gave a statistical report to the community broadly a number of weeks ago, and we're working on that, and we can give an episodic update for sure. I don't know if 14 days is really the number to see if you that I would use. So every 2 weeks, I think that would be good, and we can commit to. Today is Tuesday. We can commit to a report next week, and among that line we'll include where we think we are with seasonal agricultural residences for sure.
Thank you, Dr. Nisathere. And just one more, the common thread in all the communications I've received from the farming community is the question of why is Haldeman Norfolk the only health district to use the 3-person per bunkhouse rule? Could you just give the most significant reason for that fact?
So Haldeman Norfolk is also at the highest risk. It has the highest number of seasonal agricultural workers per 1,000 people in the entire province. It is by as a percentage, it has 3.9% increase in population. The next increase in population is Windsor-Essex, which is 2.1. So it is at a very, as in the aggregate risk, it is definitely a place that has a high risk for higher than other places in the province. The second issue I would add is, or the second point I'd make is that we're not the most conservative. We are conservative. That is true. That I'm always practice medicine conservatively. British Columbia requires people to go to a hotel. The bunkhouse option, as reading the British Columbia, is not an option in British Columbia. We get 3 options: it's the bunkhouse, the hotel, the trailer. So that is an accommodation that we offer.
Thank you, Doctor. Madam Chair, I am ready to switch with you if you are, but if I am going to be the chair, I believe Councillor Van Passen is next.
Okay, carry on.
Well, thank you, Acting Chair.
You got, that was okay.
I seem to get confused sometimes here. Every time somebody talks about migrant workers, I think of the Grapes of Wrath and the poor Joad family and the time in the Depression. Any of the workers that I see around here are very skilled, trained, professional workers that come back to the same farm year after year after year. We keep getting the example of the terrible situation in Chatham where those poor workers were, infected. Those workers were there for over a year and a half, so that's a different program. The seasonal workers that come to Norfolk is under the seasonal agricultural worker program. They're not allowed to stay here more than 8 months. So obviously that's a different group of people. I think of migrant workers, that would be the busloads of workers they're bringing into Norfolk right now from Toronto, from Hamilton, from London, through labor contractors, because some of the work needs to be done, and if the bus is not full, just go under the underpass and grab a few more bodies, throw them on the bus, bring them out there. I think that's a lot bigger risk than bringing workers in, staying on the farm. They never leave the farm. I think there's a lot smaller risk to society that way than the other options that are available. But that was my little rant. But I know that our medical officer of health has done a very good job dealing with facts, with figures, always in the best interest of the health of our citizens of Haldimand and Norfolk. And I also listened to his presentation, and I see how some of the facts, figures have changed. We had no spare beds on March the 24th. Now we have a capacity. We had basically no ventilators. Now we have access to at least 75. The curve is changing overall in the province, in Haldimand and in Norfolk. And our good doctor has always based his decisions on facts. And since the facts have changed, I'm sure he will be reviewing the situation as we move forward. I would support the motion that is on the floor. That's a feel-good motion on my part, but the real work is to bring more facts to the table. I think that's been one of the problems all along, that our staff have done a good job dealing with the facts that they had available. But there was a wealth of knowledge out there that they never tapped into to try to get some more opinions, some more of the facts, and including this Board of Health as one source of information that they could have tapped into to help make those decisions. And I'm hoping that we can sort of shift that let's make use of all the information. Like we could ask Councillor Columbus and Councillor Geisens, a lot of the farms out there, their health and safety protocols to meet the standards of food safety are a lot higher than what is required under the COVID situation. They're already doing it. Their workers are in there with gowns on, with masks on, with hairnets on. They have strict rules on how often you wash your hands. When you're cutting asparagus with the little knives, those knives go into a disinfectant and autoclaves more than twice a day. Each knife has to be accounted for every day. If they lose one, they are in big trouble. That's all part of the health and safety protocols. We're already beyond a lot of that, and maybe we've got to have some more faith in our farming community a better understanding of that farming community, of what they're going through already to meet other standards, and this extra burden maybe is just a bit more than they could take. But again, I will support the motion that's on the floor, but I, at the same time, support our staff, and we'll continue. Maybe we can do a little bit better job of helping them get the information required. Thank you. Sorry, thank you, Mr.
Thank you, Board Member Van Passen. I was looking for a question in there. I guess there wasn't one. Anyway, I will then go to Board Member Chop.
Thank you, Board Member Michelle. I guess, who could have ever thought that as a Board of Health member that this would be what we are facing right now? So I guess, Mr. Chair, if I'd like to direct a question under the rules to the other member, to Board Member Columbus. How many years have you been on the Board of Health, and was it always structured this way post-amalgamation?
I believe I've been on the Board of Health here in Norfolk County since the Board of Health became part of a councillor's duties.
So the mayor has always been the chair of the Board of Health?
Yes, usually. Yeah.
Thank you. So I try not to read comments online too often, but I do pay attention. I love on the Simcoe Reformer when I'm continuously attacked for sitting as the chair of the Board of Health, that aren't I in a conflict of interest position? How is it that the council members are, the Board of Health members? What do we know about health? The mayor doesn't have a degree in public health. How can she be the chair? I didn't create this structure. This structure has been in place for 20 years now. So, do I agree with the structure? I don't really agree with the structure. I don't agree with the fact that I am the chair of a Board of Health for 40,000 people, additional to our own constituents that didn't even elect me, and Haldimand County has no say in this Board of Health. I don't agree with that. So the other rumor that's out there is because Mayor Hewitt and I have looked at working together on the water solution for Norfolk County, looking for efficiencies and the abilities to share services between the two municipalities. I also think that it's time that we as the Board of Health begin to look at how we better structure the governance model and ensuring that Haldimand has a voice at the table for their residents. And in other municipalities, I see that they often have provincial appointees that sit on the board, perhaps somebody with some medical expertise. That's not just the councillors that don't have medical expertise. So I guess now that we're in this situation and we're facing something that none of us thought that we were going to face, I have learned more about the Health Protection and Promotion Act than I ever thought that I would. But clearly it's part of my responsibility, and it's also part of each of your responsibilities. I think sitting as a Board of Health member comes with an enormous responsibility to public health, and perhaps one that we've taken for granted in the past, but it is ever more real now than it has ever been before. And so in the Health Protection and Promotion Act, there is nowhere that it provides for economic considerations of decisions. So I will not be supporting the motion, and I will actually be directing some questions to our attorney. I believe that to make a motion that specifically considers the financial hardship of the farmers, you are each acting outside those that would support the motion in your role as a Board of Health member. Because you are not at the Board of Health. This is not a council meeting. At a council meeting, we consider the economic impacts of our decisions. At a Board of Health meeting, it is about the health of our community. And so I would like to ask, first of all, to Ms. Budis, whether the Board of Health, in advancing such a motion, would be acting, in your view, outside of their capacity. And I would also like to ask you, in terms of the legal liability and exposure of each of the individual Board of Health members, should they attempt to overturn such an order from our medical officer of health.
If I may, could you break those two questions down for me again? The first, let's deal with that. And could you repeat the first question?
The first question was, within the Health Protection and Promotion Act, there is no consideration for the economics of the decisions. And as a Board of Health members that are trying to advance a motion that specifically considers the financial hardship to farmers, is that acting outside of their capacity?
Okay, so yes, I can confirm that there's nothing about the Health Protection and Promotion Act which would authorize anyone to be considering economic impacts in a decision. I can confirm that. The second thing I would like to confirm is that the sole focus of any member on this board in respective decisions that it might undertake over which you have no authority on Section 22 orders, but on anything else that you might be doing, requires you to be focused on solely the public health question. So it is a challenge when this board is made up of also elected officials. It probably creates a great deal of confusion in the community when they speak to you as your elected representative versus when they speak to you as a board member. The Act has established a liability framework under which persons acting in good faith to make decisions, whether that's the medical officer of health or any of you, are shielded from liability. The only opportunity that the Board of Health itself, and I have to double check, I'm sorry if it's the board members or the Board of Health, I think it's the Board of Health, becomes potentially liable is in the event of negligence. I have seen nothing personally here that resembles negligence. I have seen careful thought, attention. I have reviewed these things multiple times. And I can honestly say, and perhaps this is out of turn, that it has been nothing but a privilege to work with our medical officer of health every day since this started. And I too have learned more about the Health Protection and Promotion Act than I ever thought I would have to know. So let me explain. This is a pandemic. We don't have enough information to know all the right answers all the time. And the medical officer of health has given, I think, a reasonable answer to a fair question, which is that every couple of weeks he would be in a position to let the community know, as he reviews the data, what is the next right thing to do. And when or if members of the board take steps to stand in the shoes of the medical officer of health, I think it puts you at risk when you're acting outside of your roles and blurring that with potential issues related to constituents as elected members. It is hard to take off your hat as a counselor, but when you are here, your focus is public health.
If I can, Mr. Chair.
Yes, you can, board member.
Thank you, Paula, for answering that. I think it has been extremely difficult, I understand, for counselors and our Board of Health members. I can speak from my own personal experience. It is very difficult being called a racist and a Nazi by the farming community that I've tried to help. But I am the chair of the Board of Health, and you cannot make those considerations in these decisions. So with that, I will not be supporting the motion, and I will be fulfilling my duty as the chair of the Board of Health.
Yes, Board Member Van Passen.
Thank you, Mr. Chair. With that explanation and the mayor's comments, would not the motion have been ruled out of order and not put on the floor if it is considered to be ultra vires to our authority?
I'm sorry, I can't give you what the rules are on ruling something out of order.
If it says the motion is a request to the medical officer of health to repeal it, you aren't directing him. You don't have the authority to direct him.
I just, at this juncture, I'm going to just check with the clerk. the mayor has illustrated for the board the parameters on which we can make a motion. So she has indicated that it's her belief that, and it looks like it's been confirmed by our solicitor, that motions cannot be aimed at financial or economic hardship, and that's one of the parts of the motion. So I'm wondering, Mr. Clerk, if it's appropriate for me to allow the mover to amend that motion to exclude that particular aspect of it and proceed with the other components of it.
Through you, Mr. Chair, certainly you could amend. There's also, I mean, I've worked with the city of Hamilton that also had the same council members wearing two different hats. So it is a bit of thinking, but you do have a report on your council agenda later tonight that deals with the economic impacts of this. And if there is an opportunity to deal with the economic side of this at council, not at the Board of Health today.
Thank you, Mr. Clerk. In that event, then I will let the mover speak. Board Member Huffman.
Thank you, Board Member Michelle. First off, I want to clarify the fact that as a member of the Board of Health, I take my duties extremely seriously and understand that we have a great deal of responsibility for the residents of Halton and Norfolk. I have the utmost respect for Dr. Shankar Nasathari and have had many great discussions with him. My role in this, in terms of the Board of Health, is to look at that Section 22 is intended to cite specific outbreaks, which we do not have. My motion is questioning the validity of the use of Section 22 as it has been applied. And I do want to add that I would be more than willing to make the removal of the unnecessary financial hardship. The reason that was included is because that also has a great impact in terms of the mental health and well-being of our farming community, and also for the workers that are up here working in Halton and Norfolk. So I would be more than willing to make that change to my motion.
Mr. Clerk, can you make that change?
Sorry, I'm not sure if I'm out of turn, so please let me know if I am. I'm not speaking to the question of whether the motion can be amended. That's something to be dealt with between the clerk and the mover. I'm more now responding to the issue just raised by Member Huffman around the use of the Section 22 order, which is a legal question. What I can say is that the Act provides for class orders. If there was no intention for a class order to exist, it wouldn't have been in the Act. And that is true under Section 22 as well. So the issue is, in a pandemic where you do not understand everything that's going on, where you cannot control all the risks as they come and go, when you do not even understand all the risks, what is the correct mechanism for addressing those risks, before or after they happen? In the normal course, you would want to issue an order to a specific person with a very specific risk and potentially at a very specific property. And that's mostly what happens when we're not in a pandemic. We have never lived through a pandemic here. As I understand it from our external counsel, the provisions which permitted class orders came about after SARS. It has a very specific purpose, and you are seeing it being used for that purpose. So I would request that we understand the legal framework was established exactly to deal with this kind of problem where you do not know exactly the specific risk. I would also point out, in terms of how this functions, the medical officer of health, and I know no one's directing the medical officer of health. Okay, I understand that, and I understand the motion's not doing that. You are making a request. My comment was really just intended to indicate that when you're making your request, you must remember that your function is as a board member and not as a counselor, and so Hence, Member Huffman's suggestion is to, or I think it may have come from the acting chair, was to remove the section relating to the financial impacts. I would also like to point out, though, since it was part of the motion, because this is also part of the act and the way we have established our framework in this province. This concept that we shouldn't do more than what the province has said, or that what the federal government has said, that there is something wrong with this, completely misunderstands the purpose of local boards of health and completely misunderstands how the legislation was established. The purpose of a local board of health is to do things that are necessary in the local board of health. When the federal government passes a rule that implies to a country the size of ours, as diverse as ours, that cannot possibly understand what is going on locally everywhere. And that is also true when the province acts. So the province has chosen to make very specific decisions in very specific ways through provincial legislation, essential business regulations, which have turned upside down the lives of thousands of people. School closures. I mean, you name it. There's nobody who's been left untouched by this. When we look to our medical officer of health, he is entrusted with the very difficult situation of having to determine whether a different, potentially more restrictive rule makes sense for our situation. And so simply because the medical officer of health has made an order that may be different than the federal government, that may be different than what another health unit has chosen to do, does not make it wrong. And that is simply what I wish to impress upon the board, that that's our framework. Our entire legal framework is designed to allow local medical officer of health to do things that make sense for its community.
Thank you to our solicitor for that explanation. Board Member Huffman, are you still willing to go ahead with your motion?
Yes, I am.
Mr. Clerk, would you mind reading the motion as it stands now so that we can be clear about it?
Motion read as follows, that the Board of Health requests the Medical Officer of Health repeal the March 24, 2020 Section 22 order due to its adverse impacts upon the agricultural sector. 1, it exceeds provincial and federal regulations. Removing now number 2, that the order creates an undue financial hardship on farmers. And 3, that the order contributes to food security issues.
Thank you, Board Member Chop. Board Member Columbus.
Thank you. I did second that motion, and just want to make sure that the word request is in there. Does that eliminate us from the liability part of this to our legal counsel? Because it's the word request,
So it's a little awkward, but I'll do my best. So the issue isn't about, you're not directing someone, true. You're making a request. My personal views of whether that is or isn't appropriate is a different question. You're asking if there's that raises a legal issue for you. This is probably a novel question. What I can say is there is going to be something of a standard of care that everybody has to meet when discharging a duty, right? That's one of the elements of negligence. And so if somebody is going to make a claim that you're behaving in a way that's negligent, they may still rely on this kind of motion. That's all I can really say.
Board Member Martin.
Thank you, Board Member Micheli. For me, I guess there's a couple reoccurring themes here. One, it's the lack of communication with the agriculture community and the dissatisfaction with the order. But I've also heard repetitively that we're not in a position to remove the order, and I'm certainly not in a position to advocate for the removal of our medical officer of health during a pandemic. So while I agree that in a pandemic or emergency situation, decisions need to be made swiftly to protect the public, it also needs to be done through the lens of health and not politics. And so this is the struggle I think that we're having. I'd like to see our time spent on bridging relationships with this sector in the community. I'd also like to see our time spent on streamlining the programs and the way that they're being run. I think that there's a lot of things that are also happening in these programs that cause difficulty for the ag sector. But it's hard for me to remove the word economic from this motion and pretend we didn't just have a conversation about economic factors and move forward with it. So again, I'm going to pose a question to Dr. Nesathari. As I've continued to advocate to you, what can you speak on today right here before we vote on this about your efforts to communicate with the agriculture community? And further, I would ask you, what types of considerations have you given or are you willing to give to an alternate method that includes an isolation inside, giving calculations to the square footage of a bunkhouse so that we can potentially start to bridge this relationship with the ag community and potentially evolve this program to something that's a little bit more suitable?
So I'm always happy to meet with anybody and speak to anybody, and I appreciate the comments and the guidance. This order is not forever, and we'll review it on a regular basis. We're all, we can commit in the Public Health Service. We have answered lots of phone calls and spoken to lots of people, and through the public health inspectors and through the team, had additional dialogue. And I'm happy to engage in additional dialogue, be that formal or informal, with members of the agricultural sector. If members of the Board of Health want to help facilitate that, that would be helpful for us. We're in the, our time is compressed in part because we're managing the pandemic as best as we can. But we always want to have additional dialogue. We always want to have additional dialogue. I know Marlene and her team have spoken to many, many people. The emails would demonstrate that we've had continuing dialogue. The Public Health Service is apolitical. We just try to make our best decisions, and I try to make the best decisions. I think a motion of this nature would signal that the Board of Health doesn't support the professional staff, really who've worked 7 days a week for these past 60 days. And it never weighs on my mind as a doctor. It never weighs on my mind other than what I think is the best to advance health. I've had my disagreements with the Board of Health chair privately, but we make decisions primarily for health, and the 100 people who work at the Board of Health need the support, who work in the health service need the support of the Board of Health. So any request that would ultimately show, that would somehow seem to circumscribe what the statute was designed for me to make the best decisions for health, I don't think would be the best. It would be not the best for the Public Health Service. To the extent that we can have additional dialogue, we can always have additional dialogue. We've tried to communicate with the community broadly, and I've appeared on radio and television to message people, and sometimes that messaging is coordinated with the Board of Health chair. As it relates to orders, orders are only a small part of public health decision making. We review them on a regular basis, and we review them recognizing that sometimes they're more impactful on some people than others. So we'll definitely work on more communication and dialogue, and I know you've shared with that privately. I'm sorry. So we'll continue to work on dialogue and communication, and that's something I can commit to and even report back to you at the next Board Health meeting, as I will with the data that you had requested, and we'll formulate another data sharing event in a couple of weeks.
Member Martin?
Thank you. Sorry, and further, could I just get you to circle back to speak on any considerations you've given to the square footage?
Yeah,